As we all know that antigenic drift can cause epidemic and antigenic shift can cause pandemic. So small virus can change their expression as disease also change their clinical features. So that is very important that we should change or we should regular tune up our treatment protocol, otherwise the conventional treatment going to fail. And in the searching of new treatment, the old treatment used to fall in the garbage. And we all know about artificial intelligence. The artificial intelligence now, mm, like a pandemic, means it going to evolve our whole life as well as our present and future. And this is the future of whole world. But this artificial intelligence has been copied from human body. The human body specially made of stem cell. Special type of stem cell, some stem cell will get from our mother womb, is called umbilical cord stem cell, or it is called embryonic stem cell. But some stem cell keep in our body for whole life, which helps us for maintenance of our body. And some stem cell has been programmed in our in vitro technique in our lab, so we can treat our disease accordingly. So in our orthopedic surgery, all the proposed treatment like hip arthroplasty, knee arthroplasty, all the medicine, injection, plate, and implants, I think after 50 to 100 years of from this now, that will be thrown into the garbage because of evolution of the stem cell and regenerative medicine. Now, what are the use of stem cell in orthopedics or regenerative medicine in orthopedics? First, we have to know the basics about the stem cell therapy and regenerative medicine, which not only helps in your orthopedics question but also helps in your solve the MCQ and new modern concept. But I put this slide for all my resident to give the prompt answer and the precise knowledge for the use of stem cell therapy in orthopedics. First use, most untreated or most biased treatment or most difficult to treat condition is called avascular necrosis. Second, critical bone defects and non-union. I taught you earlier the treatment of non-union is very difficult. So here we can use the stem cell and regenerative medicine and for the a good union. And cartilage repair is very difficult to go into the joint and repair the cartilage. There are many implant, many operative technique, but it is so costly, and so learning curve is so important to give a good result. And as a result, the outcome of this operation and all implants and become very difficult to get a good treatment for the patient. So cartilage repair can be done by stem cell therapy and regenerative medicine. Now, spinal cord injury. This is a hopeless injury where doctor can't get any sources to treat, and or patient will suffering from bed sore and multiple weakness problem and multiple infection all over the body, and sometimes heterotopic calcification over the joints, and so on. And patient will lost hope, but stem cell therapy can regenerate the spinal cord injury also. Now, some old patient is suffering from intervertebral disc disease. It is also called degenerative disc disease. What is degenerative disc disease? This is a disease where intervertebral discs, the intervertebral discs The Soccer effect of intervertebral disc is depend on the nucleus pulposus and nucleus annulus fibrosus, which decrease the water content and decrease the glycan integrity in the old age. As a result, the Soccer effect will gone, and the vertebral end plate will suffer much, and due to stress riser, there will be projection of the vertebra to increase the surface area. This is called syndesmophytes, and as a result, the joint space, the nucleus pulposus in the joint space will become hard and harder enough, and as a result, there will be a pain. This is also called mechanical pain over the spine. So this is called degenerative disc disease. Along with this, there are many changes like muscle spasm, repeated pain, and but generally neurological symptoms is not associated with this type of degenerative disc disease in the lumbar region, and this most commonly affected in the middle to old age people, but it can be treated with nicely with stem cell therapy. Otherwise, if we want to do intervertebral disc replacement, but that replacement done maximum 1 to 2. You cannot replace 3 or 4 intervertebral discs. So here the stem cell therapy work, and the articular cartilage regeneration, or in case of rheumatoid disease or rheumatic hand or, or knee problem, can be easily managed by stem cell therapy. Regarding the articular cartilage, I just want to elaborate it further. Just know that articular cartilage has a normal luster. If it has multiple treatment option, but among them there is a treatment option called artificial chondrocyte implant. This artificial chondrocyte implant actually in vitro procedure where we can grow a new articular cartilage and we can replace it of the affected side. So it is a very good alternative for the articular cartilage regeneration. And where we have to go for knee replacement, we have to go for hip replacement, and that implant and all the operative technique will lost its importance when this treatment will popularized. Inflammatory autoimmune disorder is also a very problematic condition, maybe encountered by some of our orthopedic colleagues. So that can be taken care of this stem cell therapy very well. And osteogenesis imperfecta, it is a genetic disease. We cannot do much. Only we can put one telescopic nail. Do you know about telescopic nail? Telescopic nail is a special type of nail used in child, where there is multiple fracture of shaft femur, and there is a bowing of the shaft femur. We can put this nail intermediarily, and as the child grow, that nail will grow like telescopic effect. So and rather than this, we cannot do much in case of osteogenesis imperfecta. So the treatment option for osteogenesis imperfecta nowadays, as of, is very limited. Only supportive treatment, but that can be managed by stem cell therapy. And also we used to get Duchenne muscular dystrophy. It is one type of muscle dystrophy found or myopathy found in the pediatric age group, and after biopsy we cannot do much, just give a supportive care, and the typical Goyer sign is positive, and the patient will die in cardiac problem, or the patient will get frustrated with their weak limb girdle function. But if we add up with stem cell therapy, patient can manage well, and he or she can do anything in his life. And regarding the regenerative medicine is a branch of medicine where we are replacing the human cells or organ by tissue engineering and restore its normal function. But tissue engineering is a multidisciplinary approach. This is with the genomics, biochemistry, biology, chemical engineering, computer engineering, and robotics. All is mixed up with this tissue engineering. So to the next 2 to 3 slide, I will discuss some basic things about stem cell and regenerative medicine. Along with, I will discuss some most common problem in orthopedic and its new treatment protocol. Now, what is stem cell? Stem cell is a specialized type of cell which used to show the marker of CD34, and that can replicate itself, and it also change his feature up to different type of cell line. Like it can to form RBC, it can go to from a myocyte, neuron adipocyte, blood cell, etc. And there are various type of stem cell in our body. Like in an embryo, the blood and the umbilical cord, where we can get embryonic stem cell, and that embryonic stem cell have a special potency to get into the hematopoietic stem cell for and some stem cell also found in the umbilical blood. This umbilical blood nowadays kept in a special bank. This is called umbilical cord bank and umbilical cord blood bank, and this only at our Kolkata, by the side of medical college, you can see that bank. But nowadays this is a emerging topic, like blood bank or tissue banking. Umbilical cord blood banking is going to evolve day by day, and where we can save or we can preserve the patient specific umbilical cord blood sample for whole life. When we that patient will suffering from any end stage disease, we can get tissue engineering support from that umbilical blood. Or patient is suffering from any ill treated disease or very bad disease, that can back up by that stem cell. So this is a new topic, is called umbilical cord blood bank. And some stem cell is always present whole our whole body, where that will differentiated for every day, and it will help to repair our body function and maintains our body function for whole life. That need for whole life, like hair follicle, like dental pulp, like synovium, like some nervous stem cell also present in the hippocampus or olfactory bulb, some adipose tissue, some cartilage stem cell, and GI tract, whole GI tract is the inner layer of the GI tract is full of stem cell. Within 4 days, the whole GI tract can be changes, and within 24 days, the whole skin can be changes by the proliferation of the stem cell. Even when we are getting the skin graft, the skin from the nub from the hair root, there will be regeneration of the skin, and it will grow up within 2 to 3 weeks. So this is the predisposition of our adult stem cell. Now beside this adult stem cells, will need to expand our life for whole different phases, and the embryonic stem cell has some also in vitro tested for some drug delivery system. But beside this, we have specially focused on induced pluripotent stem cell. What is this? This induced pluripotent stem cell is a special type of cell which is taken from the person or a patient who is suffering from a disease, or it may be a genetical disease, or a whole family suffering from that disease. We get a biopsy from his skin, like we take some fibroblast. Suppose we take some fibroblast of that patient, and that fibroblast has some stem cell here. Now what we have done, we have tried to genetically reprogramming that in stem cell, and we will put some new information over this stem cell, which will help to the long run to get rid of that disease. Like the modified cell begins to gain the ability to self-renewal and differentiate like a embryonic stem cell, but it has been genetically programmed in vitro. So this is called induced pluripotent stem cell. This induced pluripotent stem cells can take from skin biopsy, can liver biopsy, can blood collection, and it will the main motto is reprogramming of that cell. And after reprogramming of the cell or genetic editing or de-differentiating, we can reapply this genetic edited cell or reprogrammed cell to the patient who is suffering from intractable disease. And this is the emerging field for our new treatment by the stem cell therapy, and current progress and future aspect of this treatment protocol. Now, by stem cell therapy, there are 5 types of stem cell. Is adult stem cell, we have embryonic stem cell, mesenchymal stem cell, cord blood, and induced cell pluripotent stem cell. We can treat this series of disease by stem cell therapy. I just going the only name, taking the only name: the stroke damage, traumatic brain damage, learning defect, Alzheimer disease, Parkinsonism, any tooth defect, any wound healing problem. Bone marrow transplant itself is a stem cell therapy which is used in maximum blood cancer, multiple myeloma, and thalassemia, and so on. And spinal cord injury, I have already told, osteoarthritis, rheumatoid arthritis, Crohn's disease, multiple site cancer, diabetes, muscular dystrophy, myocardial infarction, amiotrophic lateral sclerosis, deafness like age-related macular degeneration or retinitis pigmentosa can be treated very easily with stem cell therapy. Blindness and even bloodness can be treated with stem cell therapy. So in orthopedics, what does it mean to discuss this type of stem cell therapy and thing? I just want to keep up or build up the basic concept about the stem cell and its use. Now I going in details or a complex topic that is called tissue engineering. What do you mean by tissue engineering? It has a 3 backbone. First is scaffold, biological scaffold, through which the cell can regenerate. Next, we need stem cell or pluripotent cell, and then we need a biological environment to grow that cell on the scaffold that needs growth factor or blood supply. And all this tissue engineering has been done in vitro. Okay, so we need a specially custom made biological scaffold, and which is biodegradable, and we can made it by 3D printing. Do you know what is 3D printing? 3D printing is a special type of printing which can be done by assessing the CT scan or MRI of that particular part of our human body, and by that that computer programming, they can exactly printed and exactly recreate 3D structure of that part. And after this structure will come, then we put the particular stem cell of that patient specific, and we will put some growth factor over there, and that will grow up as a new organ, and we can put it back to the patient. Not only organ, most commonly in orthopedics, suppose the patient is suffering from a total meniscus disease. Now meniscus repair is a good alternative, but if we can replace the whole meniscus with a new meniscus, that will be best. So that is after 3D CT scanning, we can make a 3D model of that patient, diagnose patient specific and same size. This is suppose the medial meniscus, and this is a 3D printed scaffold. Now it put into a special culture media where we get that patient stem cell from the knee joint cartilage, scraping out from the old cartilage, and we will give some growth factor, and by which that scaffold become a newly formed meniscus, and that meniscus is replaced the old one. So same thing we can recreate external ear, we can recreate a bone, we can repair our cartilage defect. I already told some suppose that patient is suffering from a huge articular defect in the knee joint. Now conventional treatment is to do small microfracture over here. Microfracture means arthroscopically we will go into this joint, and we will drill the base of the articular defect. By drilling, this is called microfracture. Okay, this is called microfracture. But by drilling this base, what we will get? We will get some growth factor which will come through the marrow, and it will help to regenerate here the new fibrous tissue, and which will help to get a new articular cartilage. But the result of this microfracture is not so good, and that will affect only 1 to 2 centimeter defect. But when we are getting 3 to 5 centimeter defect, then there will be early osteoarthritis changes, and we have to patient who is suffering from intractable pain, then we have to send this patient for total knee replacement or total hip replacement, like that. So huge debate is there if we can treat that patient with a biological method. That is the best, because one, for making a TKR or doing a TKR is not a matter of joke. If there is chance of infection, if there is the durability, the post-operative rehabilitation, many problem is there. Operation is not a matter of joke. So to avoid this type of complication, if we treat it by biological method, that will be the best. So what people used to go first, call the patient and take a small incision, and take a biopsy or take a small scraping from the healthy articular cartilage, and send the patient back to home. Now that cell will be cultured, that chondrocyte will culture artificially in the lab with a growth factor. Now this chondrocyte, when it become the size of this defect, and which is pre-operatively has been planned or has been worked out by our MRI and CT scan, we can make exact uh, defect by a new chondrocyte scaffold. Now, two types of method has been used. One, we can make a scaffold, we can put that cell over there, we can just make a custom made chondrocyte articular cartilage, and after 2 to 3 months we'll call the patient and just open this area, and we will put this new chondrocyte implant over this, and we will just apply the new glue. This is one type of adhesive that used in modern orthopedics, and sometimes I think in after few years fracture can be treated like this glue. This glue just like a Feviquick, it will very fast to sticky enough of that new graft, and that patient will do well. But where we can't afford this type of 3D printing speciality, we what we can do, we can culture the cell only. Then on the next sitting, when patient again came, we can take a periosteal graft from the proximal tibia, and I already told you the periosteum inner layer is called cambium layer. We will fold this periosteum, and we will put this new cell in between this periosteum, and we will put this double fold periosteum over there. This is called sandwich technique, and this is also called artificial chondrocyte implant. Now this artificial chondrocyte implant, what will the effect due to the activity of the cambium layer out and in, that will again regenerate the cartilage defect. So this is amazing. Without doing a replacement of the bone loss or any ligament cut, we can get a near to normal function. So this is the all total about the tissue engineering in orthopedics. Now I just want to discuss something about the most problematic disease in orthopedics, avascular necrosis of hip. In our orthopedics, we used to get this disease sometimes bilateral also, and hip is the most common site of avascular necrosis, not due to any fracture. It can occur by any region. Sometimes it is we don't know the reason, but due to some drug effect like steroid or alcohol intake, there is a chance of bilateral AVN. Now the treatment protocol till now is not up to date and not up to the mark even. The ultimately all the avascular necrosis patient is going to have secondary way. Then we will put the patient for total hip replacement or hip surfacing. That will cost around minimum 1.5 lakhs, and that needs a specialized hand, special training, and along with a proper physiotherapy backup. But just think it twice. To get this type of operation is not a matter of joke. During the operation, patient can die. Patient can have multiple complications like infection, like post-operative dislocation, and patient can lie down over the ground. Multiple problem. So I already told you before, the durability of any implant must be very high. Otherwise, that implant should not use in our body. So this is also called biomaterial. We cannot put anything in our body because that must be cause durable effect in our body. Then only we can put it, or then only it will be approved by FDA. Now the treatment of AVN has been evolved day by day, day by day. Recently, the best treatment for where we can get any case of avascular necrosis or hip is core decompression in the early stage. When this there will be crescent fracture and there will be collapse of the head, then all the scenario will be changed, because we cannot help this patient without doing any hip replacement surgery, because it is a painful hip and head already collapsed. What we will do? So for early stage, if we can replace the articular cartilage, or you can change the or you can regenerate the articular cartilage, this is the only way out for giving a best hip, because hyaline cartilage have the least friction force, and that will be more durable for patient can do all normal activity, and he can get a painless stable hip. So during the core decompression is a special type of operation done in early stage of avascular necrosis of hip, where we will drill this neck through the subchondral bone, and we will drill this subchondral bone and in attempt to reduce the intraosseous pressure. Along with, we try to remove some dead bone and the crescent fracture debris. Now we think that after core decompression, the blood supply will increase. Some author is going to put vascularized fibular head. Some author is going to put a tantalum rod. Tantalum is special type of implant. This has a normal porosity like this is a metal, but it has a normal porosity like human cancellous bone. That will put the in this the defect, and the osteointegration through this rod will helps to increase the blood supply. This is the motto of tantalum rod. But believe me, the result of tantalum rod is not up to the mark, and when patient may need some further operation, we have to remove this rod, but due to osteointegration, the removal of the rod is very difficult. So we just try to complicate our treatment protocol. So we need such a treatment that can improve all the outcome. So after core decompression, we can put the stem cell. How we can use? We take a bone marrow, simple bone marrow, and before, it is a two-stage procedure. We take the bone marrow and we will centrifuge it in the lab, and we in a sterile manner, and we just concentrate it with a mesenchymal stem cell, and we will put it back to the patient hip when we will do the core decompression. But in our hospital scenario, believe me, this type of centrifuging and using mesenchymal stem cell from getting from back through the lab, it is very difficult. So in our scenario, what we used to do, we take the bone marrow by a Jamshedi needle, and we just put one Foley's catheter or infant feeding tube through this this defect, and after core decompression, we just put it the normal bone marrow here, and in a long duration, it sometimes help for regenerate the cartilage. And the study is going on, and hopefully in the long run, that will be the only treatment which will help in avascular necrosis, and I think then the need of big surgery will be decreased. Now another most encountered problem is non-union. Suppose patient is suffering from shaft femur fracture, we have put a nail. Now this is the present scenario. This patient is suffering from non-union. Patient is suffering from pain, and neurologically that union not going to improve. What we can do? We can do a open biopsy. We can open the area. We can divide this area. We can put the bone grafting. But for this, you need to take bone graft. So it is a comorbidity from the bone graft. Again, we have to do a big operation. Again, spinal anesthesia. Again, we can do the scarring of this soft tissue. Again, we have to do some operation. Patient chance of infection is there, CM exposure, and all. So counseling of that patient and repeated for the repeated operation is very difficult. Suppose this is our father, or he is our brother. Do you think that we can counseling them? No, we cannot. So the recent guideline for this type of non-union to put the stem cell means bone marrow. If we under CM just take under local anesthesia, we put a jet needle and we take the bone marrow at least 10 ml. Then at the same time we put a needle over this facca site under CM, and we will put this bone marrow over this non-union site, and before lifting this space, we just create 1 to 2 scratching movement over this area. That will cause aseptic inflammation, and that will help to reactivation of the bone induction by this bone morphogenic protein present in this bone marrow, or bone marrow aspiration. Do you know about bone marrow protein? The BMP is called bone marrow protein, is special type of protein which help for new osteoid formation, and among them bone morphogenic protein 2 and 7 is very important. Now another regenerative medicine in orthopedics is the domain. Maximum orthopedic problem will be treated by this domain is called platelet rich plasma. What is platelet rich plasma? Actually, this platelet rich plasma is just made of again from the bone marrow, and we will after centrifuging we will get the Buffy coat. From the Buffy coat we can get platelet rich plasma. This platelet rich plasma has immense property of healing. Like it has actually good amount of regenerative tissue, and along with the growth factor that will help to regenerate the diseased tissue like fibroblast, like our osteoblast. So most of the orthopedic problem come like osteoarthritis in the knee joint. Maximum patient in the old age came with the knee pain and low back pain, knee pain, low back pain, and a headache. At least in our OPD, among 50 patient, 25 patient will be come from knee pain. So it is the most common encountered problem. What we have offer? We just write Brufen, we just write a LCM and an X-ray maximum. Do you give any special care? Nothing. Maximum a kneecap or physiotherapy. But do you think that will working on this knee osteoarthrosis? Because knee osteoarthrosis is special type of disease where the articular cartilage going to degenerate and the tissue luster going to lost. So there is no medicine that will can revert this. Some author has been told that diacerin has an action, glycosaminoglycan has an action. Just give me one answer. You know there is a protein metabolism pathway or protein when protein come through the stomach. That stomach has and in our intestine there is some enzyme which can break the peptide chain. Then only amino acid will transfer to our body. then how you think that that glycosaminoglycan which you are going to take by oral medication, that will go to the knee joint and it will regenerate? So that is useless. And some author has backup with new peptide protein, but every protein will break down in our intestine, and only amino acid will go through the uh, parent cell and go to the circulation. So that will not going to work. So all are like a placebo. After that, patient is suffering from intractable pain, we can go for knee replacement and some other treatment like arthroscopic wash, hyaluronic acid, for that will help for 2 to 3 months. And recent guideline is we can stop that the osteoarthritic pain by intrasynovial depometol injection. Depometol injection is a very good option for osteoarthritis, but it again I am telling it just a supportive treatment. But if we give such a medicine that can regenerate the chondrocyte, that will the best treatment and best biological treatment, that is pellet rich plasma. If we put the pellet rich plasma in the knee joint, patient can easily get cured from this osteoarthrosis, but it must be treated in the early phase. You cannot treat a stage 4 osteoarthrosis, is not possible as of. And I already told about the meniscus tear, but meniscus tear can be managed with pellet rich plasma. And most commonly we get chronic tendonitis like Achilles heel tendonitis, like supraspinatus tendonitis, like tendo-Achilles tendonitis, and this type of tendonitis can be easily managed by this pellet rich plasma. Regarding this picture, I just want to give you some information. We can exact locate that tendon by ultrasound machine, ultrasound probe, and we can put this sorry, pellet rich plasma over that particular area, and we can get a good result by using the pellet rich plasma in some case of tendonitis. It really helps to regenerate the tendon, and the pain will goes for whole life. And sometimes you may need 2 to 3 repetition of this dose, but it has proven that it is a good result. And sometimes we can deal with partial aortic cuff tear, that can be also treated by pellet rich plasma. Now about the tennis elbow and plantar fasciitis, trochanteric bursitis, and sacroiliac joint dysfunction. Among them, tennis elbow and plantar fasciitis is very common. Tennis elbow is special type of pain where the extensor carpi radialis brevis is degenerated. Do you know? Extensor carpi radialis brevis maximum is come as an MCQ will degenerate, and that can cause a aseptic inflammation and over the lateral epicondyle, and that will cause intractable pain. And Cogen test is that clinical test used for tennis elbow. And tennis elbow treatment is very limited. You can use tennis elbow band, we can use NSAID, etc. But best result can be get by local depometol injection or steroid injection. But that tennis elbow can again relapse. Then what you will do? Because that depometol that can decrease the inflammation, it cannot do the regeneration of the extensor carpi radialis brevis. So if we put PRPF through this area, that will take time, but it will heal it permanently. Okay. This is emerging for tennis elbow. And same as plantar fasciitis. Plantar fasciitis is a intractable pain over the plantar fascia. Patient cannot walk properly after taking rest because of stretching of this plantar fascia is very painful and very irritating. We cannot treat this plantar fasciitis by any type of medication that will cause intractable pain. What we can do, we can give a local depot injection. That is a magical result, but sometimes it also can recur. Like heel pain, this is very notorious for treatment, because some patient will get rid of this pain after the treatment protocol. Again patient will come, like repeated trauma of tendomuscular bone tendon junction. This is also called Achilles heel insertion tendonitis. Achilles heel insertion tendonitis is a very irritating disease. Patient cannot get rid of this pain by easily with treatment. We can treat it by steroid, we can treat it by local inflammatory agent, but never ever go for steroid injection near or on the tendon junction of the Achilles. Keep in mind, and never use fluoroquinolones group antibiotic this type of patient, and never gives any local injection, because it can cause rupture of this junction. If it is once it get rupture, we lost the patient, because any operation doesn't go for any help, any treatment, all treatment will goes in problematic condition, and patient will suffer for lifelong. So that the recent guideline for tendon insertion tendonitis is platelet rich plasma, and as well this called trochanteric bursitis and sacroiliac joint dysfunction. Sacroiliac joint dysfunction is a special type of problem where patient get pain over the posterior superior spine dimple, and patient get worsening at the night time, and always complain of pain. If we put some depot injection, it will good, but it again recur. So only best treatment for by this pellet plasma over the sacroiliac joint under CM guidance, that will work very nicely. But whatever I told you or want to teach you, that the resources or the availability of pellet this the plasma is very less, because we need that in-house treatment. We have to take the blood sample of the patient, we have to process it in the lab, again we have to call this patient for a small injection or like that. But this type of treatment protocol is popularized in western country, not popularized in our country like India, because that needs a good institutional attitude, good institutional support, and in-house all dedicated team that will specially take interest of this the type of regenerative medicine field. So and due to lack of data, what do you mean by data? Do you know when we are offering any type of treatment to the patient, we must have some literature support. Means, suppose I am going to operate one patient. Now there is some liberty which has been given to the surgeon, that they can manipulate or they can change some operative technique up to a limit for the sake of the patient, but the basic principle must be followed as per old guideline. Now what do you mean by guideline? Guideline means after doing a proper treatment and getting the feedback from the follow up and getting the all data from pre-op and post-op and long-term follow-up. Long-term follow-up mean at least 5 to 10 years. After a huge data collection, that treatment protocol will be established as a treatment guideline, and all the center institute like AIMS, PGI, JIPMAR, they have own institution based protocol. So the treatment protocol can vary, but they have shown the best result after doing such um, treatment over a long time of period. So on that basis, the platelet rich plasma come into vogue for recent year. So we have not enough data to give or counsel the patient that yes, we can do it very well. Like departmental injection, we have enough data to tell the patient, and but platelet rich we have very less data in respective to other treatment protocol. So this is not popularized now, but it will be get popularized soon. Now last but not the least, I just want to put this slide not for this orthopedic uh, purposes, but just I want to give you some knowledge about human amniotic membrane. The human amniotic membrane actually one field of embryonic stem cell that can get from a freshly delivered placenta. We used to uh, throw this placenta in our hospital, and but do you know the use of this amnion? Amnion is a glistening structure over this placenta. If we peel off this placenta and we can get a thin membrane like structure, and if it is preserved, how you preserve? You just peel off from this placenta, and you have to wash it by NS thoroughly. Then we have to give some preservative agent and some antibiotic, and after that we can use it after any sterilized method like gamma radiation, or we can use it by drying procedure. But on the if we get a sterile placenta, means I just want to say on cesarean section in a non serology negative patient, means if it is a vaginal delivery that has been contaminated, but if we get it from cesarean section and freshly get mm, amniotic membrane, or we and the transfer from of the placenta from this OT must be in a sterile manner. Then we can freshly prepare this within the OT, and we can put it over the wound. So that is the mode of treatment, but the processing of amnion is very complex, but we can use it in a huge skin defect like any rotary accident, or like a burn injury, like a big flap coverage, but we cannot get the proper skin graft facility. And you just I just want to put some point over here. When we are getting skin graft, we need a defined operation, and we have to cut the skin. And do you know the skin graft bed will very painful after taking the graft, and it is a separate operation has been done, and it has some, it's a inbuilt some morbidity. But if we can replace it by a amniotic graft, that will cause amazing, and there will be no HLA mismatch type, because of the presence of HLA-G. Do you know what is HLA-G? HLA-1, 2, 3. You all know. Okay, these HLA-1 and 2 are most commonly present of the maximum human body. But when the HLA-G present in the placenta, that placenta will not going to immunologically act on fetus. That means the fetus is a foreign body in our mother womb, but presence of HLA-G, which is inactive, that cannot sense that fetal protein to the mother's circulation. It is also you can call as an encrypted protein, but believe me, the amnion has no antigenicity, and you can use it to anybody, just only because it is you have to be seronegative, and it will be freshly prepared within half an hour we can use it. And I think you can use it in eye, it's called pterygium. After pterygium operation we can replace the conjunctiva. So that is all total about the regenerative medicine. But I just want to tell you, this is not the conventional topic. You just want to know what is stem cell, what is regenerative medicine, and what are the types of stem cell that will helps in your medicine also, and all type of new emerging treatment on based on induced pluripotent stem cell, because that can be genetically reprogrammed, and we can treat Low Fermini syndrome, which is suffering from multiple osteosarcoma in their ancestor due to P53 gene mutation. We can suppress it in the long run. So this is then I am giving only one example, and some recent treatment for osteosarcoma is to take that osteosarcoma cell, and we can again do the reprogramming of that cell, and we will fuse with this cell with our normal lymphocyte, and that T lymphocyte will be programmed with a new antigen presenting cell, and with have a ability to grasp the osteosarcoma cell, and they can damage or they can kill the osteosarcoma cell when it is infused in the body. So this is another new domain in our regenerative medicine, or recent guideline for treatment is called targeted therapy, or immunotherapy. This is based on dendritic cell. The dendritic cell has a immuno cell which has a sense all type of antigen, and the helper T cells and T cells will help or natural killer cell which can sense any type of cancer cell, because cancer cell will express some antigen over his domain, and due to the fusion of the T cell, and they can recognize that cancer cell and normally can damage this cell. But in our body, some all the cancer cell will evade that immune system by blocking the PD-1 receptor, PDL1 receptor, and CTLA receptor. And this PD-1 receptor and CTLA receptor can cause the blocking effect of the cancer cell dying. But we can program that T cell, or we can treat that T cell in the in vitro by exposing the bare osteosarcoma cell or cancer cell, and we can train them, and we can send them through some drug. This is called nanotechnology, is called drug delivery system to the patient, and that tumor will vanish. So this is the emerging treatment, and I think the first slide, just look at the slide. I just want to put a small message to our newcomers, that the artificial intelligence like the all the mobile app who is going to control of our whole world. That stem cell therapy and regenerative medicine can change the game. They can all the treatment, all the injection, all the implant will lost and will throw to the garbage, and we will come in the new emerging treatment is called regenerative medicine or stem cell treatment. So this is all about this new treatment.